Hi everyone, Dr. Sean Casey here answering your health questions from Healthcare Complete Back and Neck Pain Center. Recently we've seen a big uptick, believe it or not, in shingles. Now shingles isn't something you can catch from your friend or neighbor coughing or sneezing nearby you. Shingles is actually a virus that's in our system. If you had chickenpox as a kid, it's the same kind of virus. It's a herpes virus. One of the issues we have though is that virus will stay in our system and a lot of times remain dormant for years and years and years and gets activated. We haven't found a specific trigger for that, but usually stress is a big factor. A lot of other health issues can fire it up. Now shingles will represent and present as pain, soreness, achiness, sometimes even to the point where we see rashes and blisters come across different areas of the body. In a lot of cases, we'll see patients, with back pain, as you can imagine, and find out that shingles is being involved. So we want to keep an eye out for that. If you notice that odd rash coming up, usually in a linear pattern, that's one of the factors. Now, the great thing is there are some immunizations out there for folks that are really concerned about that or they've had episodes before. The tough thing is shingles is a virus that will hit nerve fibers, which creates a lot of pain. So there's not a whole lot we can do about that, and there's treatments for it, but unfortunately, that pain can last 6 to 8 weeks, and it's not a good time. So one of the things we coach our patients on is making sure they're doing things to keep themselves healthy overall. Eating right, getting plenty of rest, obviously seeing a chiropractor to make sure there's proper alignment, because we know that when there's a spinal subluxation or when those bones of the spine are out of alignment, they will irritate those nerve fibers, create inflammation and irritation, which in turn can create enough stress to trigger a reaction to that virus. One of the other issues we look at is overall health and inflammation. If we're not eating the right foods, that's going to put chemical stress in our body. As our body gets under stress that way, it makes us more susceptible not just to things like shingles, but other viruses that are out there. So it's well worth the time, even if you're not feeling sick, to do the things to stay healthy. Another good thing to do, especially as we get in these seasons where there's a lot of colds and flus floating around, making sure you're taking the nutrients to support your immune system. So hydration, decreased sugar intake. We also look at vitamin C, vitamin D, zinc, great supplements that have shown some great research and really helping to boost the immune system so your body has a better chance of fighting off those bugs and flus that go around. But like I said, if you do notice a rash, some irritation, it's good to talk to your doctor about that. If you have any questions about that, please give us a call. We'll be happy to help. Hope you have a great day. Take care.